Hi, I am Dr. Kafali. With this video, I would like to give you some information about the labiaplasty, which is the most popular cosmetic gynae surgery these days. Because of the attention that is given to the external genital area because of the fashion, shaving, hair removal, laser, this area got a lot of attention, and it also made some ladies like their appearance or not. Many ladies these days are talking or thinking to have the labiaplasty done because either they don't like how they look, or because of the weight gain, weight loss, aging, or number of the vaginal delivery, they want to change how they look, or they want to feel comfortable with their normal regular life, because sometimes, depends on how big or how irritated the area is, it could affect their daily life during their exercise, during their fitness activity, or even during the intercourse. So as you see, many ladies have different reasons to choose labiaplasty. First of all, whenever the patient comes to their doctor's office, the doctor and the patient needs to be in the same page. They need to be really talkative and comfortable to find the best technique, best approach, and best place to do this procedure. Labiaplasty could be done either at the hospital or in the office setting. Depends on the patient request, depends on the patient's pain threshold, or depends on what kind of extra procedures will be done in addition to the labiaplasty. Because labiaplasty could be the part of the vag design or vaginal designer procedure itself. There are multiple techniques and the way to do the labiaplasty. The most common and well-known labiaplasty technique is called Barbie doll trimming. Barbie doll trimming is the easiest labiaplasty technique, but it cannot be done and offered to everybody. Every patient needs to be examined prior to the surgery decision. And all the options, all the surgical techniques needs to be explained to the patient to make the decision which one is the perfect fit. Even though Barbie doll surgical technique is well known, it's still also the primitive surgical technique. Barbie doll technique may not be suitable for everybody because it's an abrupt cut on the labia minora edges. So it's not giving the result of a normal anatomical appearance. But some ladies, the asymmetry would be one-sided, so it could be achieved with Barbie doll trimming easily and in the office setting in a really short time. So we need to choose our patients wisely. The second and the most common technique is the lateral vag resection. This actually is much better than the Barbie doll technique because it keeps the normal anatomical edges as is, and the healing is really nice, and the trauma is less to the labial area. The other labiaplasty technique is the lower V resection. This is also really good technique because it keeps the normal, regular anatomical appearance on the edge of the labia minoras. And I also do have my own technique which gives the best result for the anatomical appearance and the good healing and the shortest recovery time, which I call it Turkish moon technique, which creates the small crescent shape on the labia minora, and it gives the best anatomical appearance at the end of the surgery, and it's the fastest recovery. Prior to the procedure, patients need to be informed that the trimming or shaving needs to be done at least 24 hours prior to the surgery. Most of the procedures, either at the office setting or the hospital setting, could be done in half an hour to 1 hour time period. Recovery time would be different from person to person, but they need to be well informed that it could take 4 to 6 weeks, and an actual result needs to be seen in 3 to 6 months. During the recovery time, patient needs to know that maybe the first week or so they need to decrease their activity and apply ice and use their painkiller and antibiotic. And also the main thing is before the procedure and after the procedure, the pictures needs to be taken so the patient also can see how it was before and how it looks after the procedure. Whatever the reason for your labiaplasty, either cosmetic appearance or your personal comfort, make sure you are the one making the decision and you love yourself. If you want to get information about general OB-GYN, please follow us, and we'll see you in our next video.